is the person still on the line?
Yeah.
Can we have them talk one more time, please?
Hey, this is John from the mayor's office again. Can you speak one more time so we can check our volumes in the room?
Sure. Testing 1 2, testing 1 2, testing 1 2.
All right. Is that good? I keep hearing a periodic on our sound, or is that outside?
It's noisy in here. It's outside is noisy.
Okay. All right. Do you need him to talk one more time? Charles, does he need to talk anymore?
Oh, no. You're good. I'm ready to do something.
Okay. All right. We're good for now.
Yeah.
So we might be running just a couple minutes behind, but we should be pretty close to the mark. And then the mayor will open it up, talk for a couple of minutes, and then welcome in David. You got that? Whoops. Hey, can you hear me back in New York? Can you hear me at Goldman Sachs? Oh, I'm sorry, can you hear me? Okay, all right. So we might be running a couple minutes behind, but we should be pretty close. So the mayor will open it up. He'll speak for a few minutes, and then he'll welcome in Mr. Solomon. He can speak, and then they can have maybe a brief minute or two of banter between the two of them, and then that's it. Does that work? All right. Thank you. Are you switching mics on me now?
We got too many, so make it easy for him.
Hey, sorry to do this one more time, but they just switched mics on.
Dave, 1 2 3. 1 2 3, come on.
Yeah, I think that's his guy right there with his testing right now. Hey, sorry, one more time. Goldman Sachs, you're able to hear? You able to hear me? Are you able to hear me at Goldman Sachs? Okay, they went and switched the mic on me at the last second here, so I just wanted to make sure. Okay, but I can't hear him. All right, I can hear you from the computer, but not through the speakers over here.
Can you hear me?
Yeah, there you go. Okay, I got you now.
Okay. Terrific.
Okay. And then after that, talk a couple minutes while they
Well, good afternoon. We got a couple of special guests today. Dr. Najiba Rahman is back from her assignment to the area's nursing homes and will be talking to us today about what she did. And David Solomon, the CEO of Goldman Sachs, will also be joining us today. Yesterday, Congress passed another $310 billion in the so-called Paycheck Protection Program. As a lot of folks here know, in the first round, they passed $350 billion. It was set up for companies under 500 employees and basically allowed you to pay your employees for 8 weeks and get it reimbursed by the government in a forgivable loan. But there are a number of Detroit companies who were tied up in the lending process through their bank. And we had one bank that didn't even get their lending process up and running until the money had run out. And so we've been very concerned about making sure in this second round, Detroit companies do not get closed out. And so David Solomon, the CEO of Goldman Sachs, came forward and said, we want to step in and fill that gap. And for Detroit companies who couldn't get approved in round one, who don't have an application that's been accepted, Goldman Sachs is going to make $15 million of loans for Detroit companies through the Community Reinvestment Fund USA. The application is open now on our website, and if you've been frustrated at this process, Goldman Sachs is going to be here to help you. And by using the Community Reinvestment Fund USA, they're working with the largest nonprofit, non-bank SBA lender in the country. And so is Mr. Solomon going to be with us shortly?
I'm here, Mayor Dugan.
Oh, good. So let me turn this over. Do we have him up on the screen? What do we? Sorry, David. We have a little glitch. We want to make sure everybody can see you.
No problem.
And with that, I know he's got a few things going on in New York, but to imagine that the CEO of Goldman Sachs is not too busy to help out businesses in Detroit that got closed out in the first round, let me turn it over to David Solomon.
Thank you so much, Mayor Dugan, and good afternoon to you all. And I first want to commend you, Mayor, for hosting daily events like these to keep Detroit residents informed. We're so appreciative of all you and your team do to help small businesses in the Motor City. Such a commitment is even more necessary during this crisis, where, as you highlight, so many small businesses are threatened. The crisis has served, in our mind, to underscore just how important small businesses are to the economy, both on a local and a national level. Small businesses truly are our economic foundation, employing half of the American workforce and serving as the bedrock of our communities. We at Goldman Sachs began the 10,000 Small Business Program to promote this vital part of the American economy and to provide opportunities for small business owners to learn and implement financial best practices, as well as to connect with one another. 10,000 small businesses came to Detroit in 2013, and since then has seen 550 businesses complete the program. But now, 7 years later, small businesses have perhaps never been at more risk. No one company, city, or state will be able to overcome this challenge. Dealing with a crisis of this magnitude is the intersection of the public and private sectors that's so critical. We at Goldman Sachs are trying to do our part as a part of our ongoing partnership with the city. As the mayor suggested, Goldman Sachs is committing $15 million to loans to Detroit small businesses. This is in conjunction with a $550 million national commitment that Goldman Sachs announced to aid small businesses and communities that are suffering through the coronavirus crisis. These emergency loans are being made to small businesses as part of the Paycheck Protection Program under the CARES Act, which Congress moved to reinforce this week. They will provide urgent cash flow assistance and are designed, as the mayor highlighted, to partially or wholly forgive if necessary criteria are met. Detroit, we've partnered Community Reinvestment Fund, or the CRF, in this effort. And we thank Frank Altman and his team for their tireless efforts throughout this crisis. In these unprecedented times, we continue to engage with our 10,000 small business community. Most recently, we surveyed almost 1,800 graduates from across 47 U.S. states and U.S. territories on Monday and Tuesday to get their feedback regarding the Paycheck Protection Program. We saw one glaring disparity. The application rate for Black small businesses was 12% lower than the overall rate. This is troubling. It's clear we need to do better. This is something we're committed to addressing, and we feel lending PFIs CRF is the most effective way to raise awareness and allocate capital to those who are underserved and need it most. We hope that today's commitment helps address this gap, but clearly more needs to be done. Beyond providing capital, we view partnering with the CRF and Mayor Duggan as a critical piece ensuring this capital actually reach underserved Black-owned businesses. So on behalf of Goldman Sachs 10,000 small business community, I again thank Mayor Duggan for inviting us to participate today. With that, I'll turn it back over to you, Mayor.
So thank you very much, David. I've been to a number of your graduations for the 10,000 small businesses, and it's been transformational. There were a number of companies who have been operating in Detroit for years at a small level, and essentially they get an MBA at a very practical way, and we've seen several of them add new business streams, hire more people. It's been a tremendous partnership, but I don't know how many complaints I've heard, particularly from Black-owned businesses in Detroit in the last 2 or 3 weeks, that somehow they were left out of the line with their local bank on the Paycheck Protection Program loans. And so to have Goldman step in here with $15 million of loans, basically saying, if your business is located in Detroit, we've got a way to move you to the front of the line. So go to the city website and you will see the application process through the Goldman support for this program, and you can get in today. So go on, file an application this afternoon. If your application has not already been accepted through another bank, go on this afternoon, get filed, and you're going to get one of the great bankers in America to take care of your case. So thank you so much for your support.
Well, it's my pleasure. We've had a great partnership with the city for a long time, and we're glad to do our small part in trying to be helpful here. So thank you so much for having me today.
All right, look forward to seeing you in person.
Absolutely, I look forward to that too.
All right. So it gives you a sense again of the fact that the country has been behind us, and this is just so reassuring. And I want to talk about what we have done now within the city. We've got updated numbers for you, but I'll start with the governor's announcement today. Glad she eased up on the gardening and some of the other things, but the big announcement she made is that you have to be wearing a mask in public. And let me tell you why that is important. The city of Detroit has now completed 15,000 tests, and here's what we know. If you have symptoms, there is a 40 to 50% chance you have COVID-19. That is, if you're coughing or you have a fever or you have shortness of breath, there's a 40 to 50% chance you are COVID-19 positive. Might be asthma, might be bronchitis, might be allergies, but if you've got symptoms, 40 to 50% chance it's COVID-19. If you don't have any symptoms at all, there's a 10% chance you still have COVID-19, that you're infectious. This is what we know after 15,000 tests, that if you go into a room of 10 people that all look healthy, the odds are one of them is infectious right now. And that's the way this disease is spreading. It's spreading by people who appear to be perfectly healthy, and 10% of them are currently positive. And so the reason to wear the mask is to protect your family, your friends, and your neighbors if you happen to be one of those 10% who just isn't aware that they have the disease. We have updated numbers today. But a couple of the first ones. The hospitals are continuing to report on a daily basis. Patient volumes of COVID-19 patients are down. Use of ventilators is down. Hospitalizations is down. And as I will continue to say, our central report card, the TCF Center is now down to 13 occupied beds. Don't know how much longer it will need to be there, but I was really pleased to see the Secretary of the Army who visited last Friday, and he was celebrating the fact that while the Army did an outstanding job of setting up that 1,000-bed hospital at a time that looked like we were going to need it, he was celebrating what Detroit had done to make sure that we had not. The nursing home survey is complete, and I'm going to let Dr. Rahman talk about that, but what they accomplished was remarkable. They tested 1,920 residents in 10 days, found a 26% infection rate, and I think we now have a real opportunity to get that under control. We've got 149 deaths in the nursing homes. I'm sure before we're done, the numbers will be higher, but I think our senior citizens who are in the nursing homes today are a lot safer today than they were 2 weeks ago because of the work of Dr. Rahman and the health department. I want to talk a little bit about our statistics. Do we have a chart? We have the chart up. We have today 816 deaths in the city of Detroit. More than 1 in 1,000 of our neighbors has died in the last 3 weeks. But the reporting of the numbers, as I continue to say, just doesn't mean anything. The data collection process is so delayed. So here's what we're going to do from now on. We are going to post on our website the chart that we are showing right here. And what that chart shows is the number of individuals who died each day. And so a lot of times we'll tell you it's 30 people reported today. Some of those date back to March. Doesn't really give you a sense of what is happening. But if you look, you can see from about April 14th and 15th, we have had a steady decline in this city. And we've been running the last several days 18, 20, 18, 17. Those last couple days we shaded in gray because those numbers will still be coming in. But this is really the best way to assess how this is going. And the cooperation of the people in this city, our residents, in keeping distance from each other is what is starting to bring this under control. We have opened the fairgrounds to people without prescriptions and without symptoms. And we've invited companies to send their employees in. And it has been absolutely fascinating. We are now approaching 300 companies and 15,000 employees. But I'm looking at who's actually getting in and getting tested. And so if you were wondering, if I want to get carry-out this weekend, where can I go who really cares about my safety? I can just tell you the first perfect score goes to Turkey Grill on Woodward. And anybody who knows George Lyles won't be surprised at his commitment to the safety of his customers, but they have 17 employees that work at Turkey Grill. All 17 have already been in to be tested. This is the kind of dedicated business person that we love in this town. And as we go forward, I will report on the others who are the earliest at getting 100% of their employees tested. But Turkey Grill is one that nobody on my staff would be hesitant at all to get a carry-out on this weekend. On the grocery stores, the reports are more disturbing. And now that the nursing home situation is under control, I am going to turn my attention to the grocery stores. Because I have been very disappointed at the attitude of some of the grocery store owners about getting their employees tested. What we're seeing is a kind of mixed bag, I guess maybe I should have expected. Over at Mike's Market, they started sending people in to get tested right away. Mike's Market's always been a part of this community, and I would expect them to want to protect their customers and get them tested quickly, and I appreciate everything that Mike's Market is doing. On the other hand, we've got another grocery store in this town that has been in the news lately for allegations of price gouging and spoiled food. And our interaction with that grocery store indicates they really don't seem to care less about getting their employees tested. And I'm just not going to put up with it. So we are now going to start to crack down on the grocery stores, the food handlers in this city, because if you're going to look at where is the next most likely spread now that nursing homes are being addressed, it is the people handling our food. And so I'll let you know now so you can get a head start, but I expect by Monday, May 11th, that the grocery stores in this city be able to demonstrate to us that every single one of their employees has a recent negative COVID-19 test. When you couldn't get tested, you had an excuse. Now there's no excuse. We can get you tested within a few days at the fairgrounds at no cost. If your employees are not going in to get a free test, there's a real question about the way you are operating your business. And so I expect that our health department will issue a formal order on this on Monday. But we are going to track intensely the grocery stores, and by this I mean people who primarily make their living selling retail food. We aren't applying it yet to the drugstores or the gas stations who do some food sales, although we'll get there eventually. But the people who make their primary living selling food on a retail basis, we are going to expect them to have their employees with negative tests if they're coming to work by May 11th, or we're going to take appropriate legal action to make sure the residents of the city of Detroit are safe. 2 weeks is plenty of time. Every dedicated owner of a grocery store has got plenty of time to get their employees tested. And if you aren't committed to the safety of your customers, I'm going to make sure you're not able to continue operating in the city. Detroit residents deserve the highest quality of safety in their food, and over the next 2 weeks, we're going to assure that we will get it. And at this point, I'd like to turn it back to the folks on the health side, because I'm not sure anybody in America has gone through nursing homes and assured the safety of the residents at the speed we have. And so with that, I want to turn it over to our health director, Denise Fair.
Thank you, Mayor. Now, I'm pleased to share that our testing strategy for all 26 nursing homes in Detroit was completed yesterday as scheduled. I'd also like to thank and acknowledge Dr. Najiba Rahman, who's the medical director for the health department, who you'll hear from shortly, who led this effort. Now, the team at the Detroit Health Department has worked towards diminishing COVID-19 spread in these facilities because we know this is where the virus can thrive. They're in congregate settings. And so we decided to put seniors first. So here are the results from our efforts in the nursing homes. We've tested approximately 1,900 people. There are now 478 confirmed COVID-19 cases with an infection rate of about 25%. Unfortunately, there have been approximately 150 deaths. We've also had the opportunity to distribute PPE to the nursing homes who requested. We distributed 12,095 masks, 10,000 gloves, 150 gowns, and 300 face shields. I also want to take the time to acknowledge the partnership with the City First Responders, Henry Ford Health System and their clinicians, the Wayne State University medical students, because our seniors are now better protected from COVID-19. So now I want to hand it over to Dr. Rahman. She's been the woman behind the scenes who will share her personal experiences of what it's been like in the nursing homes, because she has been able to help protect our seniors and our staff. So with that, I'll turn it over to Dr. Rahman.
Thank you, Chief Fair and Mayor Duggan. Without your leadership and support, we wouldn't be able to do all of this. And so I just really want to stress how lucky this community is to have so much support from the public health standpoint. And so I just want to tell a little bit of a background on how we got here. So, you know, we had cases coming in a few weeks ago, and our chief epidemiologist, some of the physicians and myself started talking about these high-risk groups, like the homeless community, as well as our elderly population. And so, you know, we decided we should probably go in and start testing. I brought it up to our leadership above, and we decided, why don't we just go in and test everybody in all 26 of our nursing homes. And so we came up with this 10-day strategy. And we had our partners, as Chief Fair had mentioned, working day and night, from getting lists of residents together, all the way to planning the operations, getting teams out to do swabbing, and then up to working throughout the night to collect the lab results and report them out. So this was a truly collective effort and multidisciplinary, multi-institutional, and it really underscored how well our community came together. And being in Detroit since 2010, I've never seen anything like this, and it's phenomenal. And I want the community to see that. So I want to share one of my experiences of one of the facilities I had been involved with more closely. And so after the results came out, I asked, can I come by tomorrow and do a walkthrough? The staff was really overwhelmed, and she said, you know, it's going to take a long time to move people around so they're infected versus those that are not. And also the disinfection process would take up to 100 minutes for one room. And this was a pretty big facility with over 100 individuals. So I said, well, why don't you just walk through for a few minutes what your process is going to be, and I'll come back in a few days. So my team and I came back a few days later. We did a walkthrough. We asked some of the hard questions and some of the easy questions, and realized that our physicians and our environmental health teams that had gone out had done a really great job. You know, they were able to articulate and really demonstrate how effective our interventions had been initially to properly cohort or move individuals around, so that we could help mitigate the spread of the infection in their facility. At the end of that conversation, it was about 2 hours. It takes sometimes 2 to 3 hours just to go through one facility. We stopped and we talked to the director of nursing, and we just asked, how are you doing? And I don't know if she had ever really asked herself how she was doing, and you could feel the sense of relief over her face. She had softened. You know, we were able to talk about herself and what she had done, and her struggles of losing patients that she had worked with for years on end that were there in those facilities for 20 years. And so I really want to highlight that, you know, these are our warriors, these are our heroes. They're doing this every day. They're not sleeping, they're not eating. They deserve the love and respect that we are all giving, but it's a different level when you're actually walking in there and you see the calm and the peace and the quiet that has come from the interventions that we've done from the public health standpoint with all of our partners. And so, you know, we've gotten through this acute phase of doing all the testing, and the work is just about to begin. You know, we're going into the recovery phase, the long-term work that's approaching us. And so we're very fortunate to have the CDC next to us. We have experts in disaster preparedness, a laboratory microbiologist that was doing the testing for the CDC when the outbreak first emerged, a behavioral scientist, as well as a clinical epidemiologist, and the state health department, who are ready to be next to us when we start going into that phase, as our partners start returning to their duties, and really getting these teams together to continue to provide education and support. And at the end of the day, we've highly strengthened these relationships that we have with the nursing homes. Our communicable disease teams are always investigating disease outbreaks in the city, but you know, this has taken us to a whole new level where we're talking and we're texting and we're checking on each other. And you know, at the end of the day as well, we're protecting our community, and it was truly a joint effort. And I think it has really changed the direction of public health, not just in Detroit, but like in the entire country. So, and I'll pass it back to Chief Fair.
So much, Dr. Rahman. And again, it's always good that we can highlight those who are working the front lines and who are working on the ground. So again, Dr. Rahman, thank you for your continued leadership. So let me switch gears now. We're going to talk about the numbers for today. As Mayor Duggan mentioned a few hours ago, Governor Whitmer extended her stay-at-home, stay-safe executive order through May 15th. And I stand in support because in Detroit, we have made a lot of great progress, and that's because of you. All of you are stepping up and being responsible, and we are bending the curve. So we must stay the course, and staying home is the best way that we can continue to decrease the number of cases and also save lives. As of today, there are 8,471 confirmed COVID-19 cases and 816 deaths in the city. And my heart always goes out to those who have suffered loss. My message is still the same. If you are experiencing symptoms of COVID, which are the 3 symptoms, fever, cough, shortness of breath, please call your doctor and get tested. If you don't have a doctor, you can call the Detroit Health Department at 313-876-4000. We have over 30 doctors who are willing to accept new patients, whether you have insurance or not. Continue to wash your hands, use hand sanitizer, disinfect surfaces, keep 6 feet away from each other's, and wear a mask. It's so important. Go outside, get some fresh air, but also wear a mask. And also avoid any unnecessary trips away from home. So finally, COVID-19 cannot defeat us if we continue to support each other, care for each other, and of course, hold each other accountable. So let's stay well, Detroit. And with that, I'll turn it over to the mayor for questions.
We'll take any questions.
Good afternoon to you all. Ken Coleman, Michigan Advance. Sorry. Mr. Mayor, given Governor Whitmer's directive today, at least the part about wearing the mask, you've talked in recent days and recent weeks about what your law enforcement folks will do and won't do with respect to distancing and wearing gloves and hats and gloves and masks. From a law enforcement perspective, can we expect to see police officers, in addition to handing out masks, issuing tickets to people who aren't wearing them?
You know, I don't know that that will be our highest priority. The Detroit police officers will focus primarily on breaking up crowds, but our police cars do now have masks and plastic bags in their cars. And if you see a police car and you don't have a mask, if you flag it down and ask for a mask, I'm certain the officers will be very courteous and give it to you.
I've actually seen that twice.
Have you?
In
That's what they've
recent days.
done.
Yeah.
So no, we're at this point trying to encourage masks as opposed to criminalizing the lack of masks. On the other hand, if you gather in a cluster, as everybody in this city knows now, your neighbors will call instantly and the police will be there in a matter of just a few minutes. So our enforcement isn't going to change. I do think the governor did the right thing in changing the focus. And I'm going to say this, of the 4 million people in the Tri-County area, based on the tests we've seen, and we've tested a whole lot of suburbanites at the fairgrounds, I think 1 out of 10 people in the Tri-County area has this infection and don't know it. And it doesn't matter. You can be out in Wyandotte, you can be in Southfield, you can be in Clinton Township. The odds are that 1 out of 10 people who think they're well is spreading that infection right now. And so everybody should be wearing a mask.
And then quick follow-up. The update on the Abbott, the 15-minute Abbott testing machine.
Yeah, we're over 5,000 tests done now. And it's been terrific. We got 3 more machines that we put live today, and so we're running 8 a day instead of 5 a day, which is great for our team because they don't have to pull all-nighters, as Dr. Rahman had done before. We only had 5. We're now spreading them out to 8 machines for 10 hours a day. And I know Dr. Rahman's going to appreciate that. How late were you there doing those tests?
I mean, I was there till midnight sometimes, but last week one of our teams was there until 3:30 in the morning and came back at 6, so lots of work.
And you're in negotiations for a lot more.
No, we have 10 more,
Okay.
and so we've deployed 3 already, and that'll allow us to stick to a 10-hour day instead of people, these Wayne State med students being in the labs at 1 and 2 in the morning was remarkable. Dr. Abad herself at one point offered to stay all night, and I told her that wasn't going to happen, so she left at midnight. But now that we have the extra machines, we're there. When Abbott is able to produce more kits, and that's the limiting factor in the country right now, we have 15 machines, and then we're able to do what I'd love to do, which is I'd love to have remote sites on the west side, the east side, and southwest Detroit. And when Abbott's kit production increases, which they think will happen by the end of May, we'll be able to deploy the 15 machines across the city.
My first question is regarding the business loans. Are those connected to the forgivable loans that
Yes.
the government?
These are the forgivable loans.
Okay, so it won't be anything attached to it.
It's exactly what we had before, where the money ran out. If you haven't had an application accepted, you're under 500 employees, and in this case, you're in the city of Detroit, because Goldman is now taking the city of Detroit businesses and put them at the front of the line in their queue, you can get the forgivable loan.
All right, and then are they helping with the applications? What you?
Yes, that's what they're here for.
Okay.
So you go to the site that's listed, and you can apply literally this afternoon if you're a business in Detroit. And if you haven't had your application accepted by another bank, you should go on today, because this next $310 billion is going to run out before everybody gets it. And this time, I want Detroiters at the front of the line, not at the end of the line.
And then when it comes to the question was brought up to me, the senior places, are we also including like the smaller, I know those are probably the bigger units, but there's a lot of, what do you call it when people take care of people, and like it's 6 in a home, group homes and stuff like that, but there are seniors that are technically, you would call it a nursing home, but they're...
The adult foster care.
Yes.
So we're going to let Dr. Rahman have till Monday before she rolls out the plan for the skilled nursing facilities, the adult foster care, the mental health residential, senior citizens. We are going to roll out plans for all of those, but I thought I'd give her the weekend off, and she'll be back with those plans next week, won't you?
Can you give a number out so people who have those, how do they get in line to make sure that they're in the city of Detroit, I'm talking about?
Yeah, you won't have to call us. We'll call you.
Okay. Thank you, Mr. Mayor.
Okay.
The question regarding the buses, the follow-up. I did go, approach a bus in the afternoon, and there was no mask. Can we make sure that that issue is resolved? But now we
There
know
was no mask where?
on the buses in the afternoon.
What line?
We were on, I want to say Grand River.
You're on the Grand River
Grand
line
River
this
6 Mile area.
afternoon, and the box was empty?
Yes.
Okay, I'm going to find out why.
Okay. Thank you, Mr.
All right.
Okay, Mayor, just a couple of questions from reporters who are watching remotely. One is, among the nursing home confirmed cases and deaths, were any of them staff, or are they all residents?
Do we have one staff member?
Yeah, so it was a couple of staff, yep,
Among the confirmed or among the deceased?
among the confirmed, as well as among the deceased.
Yeah, we can get you the exact number. 1 or 2 deceased staff members. The balance were residents of the 150.
Okay. And then one other question, this is just on the Paycheck Protection Program. Cranes wants to know if we know how many Detroit businesses may have gotten approved or accepted into that in the first
I have no way of knowing that. That goes through the individual banks. All I hear from is the ones who didn't make it through the pipeline before the money ran out, and those are the ones we're trying to help.
Okay.
But I don't know if the federal government can give you data on how many were accepted.
Okay, and that was the last question.
All right, thank you very much.